live from the Connellsville Canteen. It's Late Shift with your host, Mary Sampey. On tonight's show, Erica Usher, Stephanie Welk, Roxanne MONGELLUZZO. Now, here's your host of Late Shift, Mary Sampey.
Hi, and welcome to Late Shift. I'm your host, Mary Sampey. Tonight we're going to be talking about something a little bit more personal in my life. We're going to be talking about the opioid epidemic. And as we know, the opioid epidemic has just affected so many people, not only in our own local communities, but across our nation. And I know firsthand because in December 2016, my sister tragically lost her life to a heroin overdose. And since that time, my family has just kind of trying to decide what we can do for the community, what kind of things can we do to turn the pain that we feel of losing my sister and my niece's mother into something positive for other people so that they can know that they're not alone. Well, thankfully, as part of that journey, I've gotten to meet some really amazing people along the way that are truly a light in the darkness of this epidemic. And when we come back, we're going to be talking to some of them to celebrate Recovery Month and talking about some of the great things that they offer. We'll be right back.
Summer is here. That means the kids are back in the house. That means streaming, gaming, and video chats. It also means you need Zoom. The area's fastest and most reliable internet service makes it easy for everyone in your home to safely and securely surf the web at the same time. Whether they're gaming with friends online or streaming video by the swimming pool, Zoom keeps everyone happy. Call today and we'll help you find the Zoom speed that's right for you. The future is faster with Zoom.
Hi, and welcome back to Late Shift. I'm your host, Mary Sampey. Today we're going to be talking about the opioid epidemic and what it means for our communities. And more importantly, we're going to be celebrating Recovery Month, and we're going to be talking about the amazing resources that we have in our local community. And with us today, I have three amazing women who are truly just the light in the darkness for so many things that are going on today, and just have a true passion and a love to serve other people. And so the first person I'm going to introduce you to is Erica Usher. Everyone welcome her to the show. And Erica works with Fayette Drug and Alcohol. And with us as well, we have Roxanne MONGELLUZZO from Connellsville Counseling Services. Everyone welcome her to the show. And lastly, but certainly not least, we have Stephanie Welk, who is a certified recovery specialist for Highlands Hospital. Let's welcome her as well. So as most of you know, I work full-time for the churches in Connellsville and Dunbar as the director of evangelization. And a lot of the work that we do is just to be there for the community and let them know that we're truly here to serve the community, that we really want to meet people where they are. And because of Father Bob's presence in our local community of Connellsville and beyond, I just really got inspired to get involved with a lot of the different things that are going on and to kind of just spread hope and awareness to things going on in our community, and specifically with the drug-related issues that we have. Especially after I lost my sister, it was something that just kind of became a passion of mine. And if that would have never happened, I wouldn't have gotten to meet any of you and even known that any of these things were going on. And unfortunately, that's usually the case when it's not even on your radar. And then it's not until it happens to you personally that you really want to get to know what resources are available for those people who may not have hope, who may feel like they're alone, and they may feel isolated. So I want to start with you, Erica. Tell us about your work with Fayette Drug and Alcohol and the different services that you provide.
Sure. So Fayette County Drug and Alcohol Commission is the single county authority for Fayette County. Really what that means, the Department of Drug and Alcohol Programs sets an organization for each county to receive state funding and to ensure that services are occurring in that area. So some SCAs are rather small, they're a pass-through for funding. Our SCA, we provide treatment at our office. So because we're rural, we want to make sure that there's as many options as possible for people. So we offer outpatient treatment services. We have case management services at our office. We also offer prevention services, and I'm the prevention supervisor, so that's the area that I get to focus on. But I'm always fortunate enough to represent the office in public related to everything. So prevention services are about engaging the community and ensuring that that we prevent drug abuse from happening, and what that means can get kind of complicated. It's not always what people expect that will look like. There's a science behind it. We use a lot of data to make decisions and to find programming that's been proven to work, and then try to make sure that occurs in the county. And sometimes we're the ones that deliver it. We have prevention staff that are certified in certain programming, and they will deliver, and sometimes we work to ensure that others have capacity to deliver it in our absence. So it's a wide range of services that happen at our office.
Yeah, absolutely. And I know since your passion is prevention and evidence-based, tell us a little bit about what the difference is between an evidence-based program and something that someone might just make up or decide that they're going to be doing.
So as I mentioned, there is a science behind prevention, and this work was really driven from research around heart and lung disease. So just follow me on this little path for a second. What we now know that there are things that increase someone's likelihood of developing heart and lung disease. They call them risk factors. So if you have a poor diet, if there's poor air quality, if you use tobacco products, these things increase your likelihood of that disease developing. There are also things you can do to prevent. There are protective factors to keep you healthy. So if you exercise, if you don't use tobacco products, if you eat a healthy diet. So this concept, we are now able to apply that to substance abuse and a number of other problematic behaviors, health and behavior problems. So substance abuse is one of them. There are things that actually increase the likelihood of a community having a lot of people afflicted with this disease, and things that a community can do to help protect against that. So it's that science piece. So the important thing is for us to collect information and to know our community, know what risk and protective factors exist in our community, and then choose programs that have been proven to have an outcome related to that, which means that someone researched them, they implemented them, they researched them, evaluated them, ongoing, and that these things have been proven to have a result. So the good news is that there is now 30, 40 years worth of research around programs that have been proven to be effective. So if I say to you that this program is evidence-based and it's a model program and it's a really, really good one, every place that it was replicated across the country, in some cases in other countries as well, they got the result that was intended. And so while I could come up with something on my own, I have a lot of knowledge related to prevention, we could do some type of programming, I would never say that my program is evidence-based. It might feel good, it might make me feel good to do it, people might respond to it well, but without that evaluation and that research, we can't prove that what I did made a difference. So we really try to educate people so that they're selecting good programming, that they're not picking things that just feels good or that we like, but that actually will have an outcome and a result. And so then we know that we are being effective.
And I think that's so important too, because what obviously is going to work for a specific community isn't even going to be an issue in another community. So it's something that, it really does require a lot of that science behind it. So I think that makes, a lot of good sense. Something else that I've gotten to work with you just recently is with Fayette County Overdose Task Force, and with Stephanie as well as on that task force. Can you tell us a little bit about those who may not even know that Fayette County has an overdose task force, what we do, the kind of initiatives that we're starting and getting behind right now?
Absolutely. So the Fayette County Overdose Task Force is co-chaired by the director of our office, Janet Kyle, our executive director, and the Fayette County District Attorney, Rich Bowers. So we received some technical assistance, and our focus is to reduce or eliminate overdose in Fayette County, and our group gathered some information. We just created a strategic plan. Right now, one of the pieces of that strategic plan is gauging how does the community view addiction. So we have this survey that we have dubbed the stigma survey. We're trying to gauge what does the community feel about addiction as a disease, or about people that have that disease? What does that look like? We don't want to, again, back to gathering data and using that to drive decisions, we don't want to make assumptions. We want to use actual factual information and then see what we can do to influence that. Unfortunately, because of stigma, it can make it harder for people to receive treatment. And by that
Yeah.
I mean it becomes something that people don't want to talk about. They don't want to seek out resources for others that they care about because that it becomes a shameful thing. And
Right.
we want to try to influence that. We want to make sure that as many people get help that they need because there is no shame. This is a disease that can afflict anyone.
Absolutely. I was so encouraged when I first walked in there because first of all, I had no idea what I could add to the conversation or what I could even offer other than being from a faith-based background and getting to just for myself gain the education of the resources that are available. But I was so encouraged of so many people from just all around Fayette County coming together. Can you talk about a little bit about the specific members and who are all involved? It's pretty remarkable, all those people in the same room when you think about it.
It is actually. So we have our Fayette County commissioners that are involved. The Fayette County sheriff is involved. We have representation from the coroner's office. We have people in recovery. We have professionals working with people in recovery. Me in prevention, I get to be a part of that too. We have faith-based folks. So there is a wide variety. We always look at everyone has something to bring to the table because everyone has a different perspective, and we need all hands on deck really to have that full picture.
It's really just amazing to just watch so many people that are just from, different political, and none of that even matters. It's just, hey, we need to really just come together and talk about this because just seeing how much they care about these people, it just was really encouraging. And I just sat there thinking, wow, people really need to know that this is going on. People that think that we're not doing anything, like we're sitting here all together in the same room regardless of what we agree on or disagree on, to try to be there for our people. And it's just a really amazing thing. Since you've been involved in this, I know that you probably have a lot of good days and probably have a lot of bad days, but since it is Recovery Month, could you share just maybe a story of hope or an inspirational story that you can think of when you're having a bad day about how recovery is possible?
So one of my favorite stories to tell actually involves someone that's involved with our overdose task force, and it's something that he always says, speaking as someone in recovery. And the quote that he always shares is, when I was using, I was a hopeless dope fiend, and now I'm a dopeless hope fiend. So I love that. And the first time that I heard him say that, I thought, wow, that's really, really amazing. And then to learn so much about what a strong recovery community we have in Fayette County, that there are so many people that are willing to help and help others. That is just, it's amazing. There are people that come from other places, from other states or from other parts of Pennsylvania that come here to Fayette County to live in recovery because we have such a strong recovery community. I think that's something that's so positive and hopeful that I want to share. The people don't know that here in little old Fayette County. Here's a place to come because there are so many people. We have such a strong network.
Yeah, that's wonderful. And when I think about just hope in general, I think that, Stephanie, you just epitomized the fact that people do recover and that they can live their life fully with passion and purpose. So can you talk about your journey to become a certified recovery specialist?
I'll kind of tell you a little bit of, how, what happened in my life, what led me, to recovery, and why I decided to become a certified recovery specialist today. So I am an individual in long-term recovery. That means that I haven't used a mood or mind-altering substance since October 12th, 2015. So I'm coming up on 3 years clean. I had a normal childhood. My parents got along great. I was raised, I was born and raised Catholic with good morals and values. I did well in school. I graduated. Here and there in high school, went to parties, dabbled here and there, but never had any serious issues. And went to college after, high school and everything. And all of a sudden, I was in a couple car accidents, and I had surgery, and I was prescribed prescription pain medication. And this was in the early 2000s. This was before, this opioid crisis became what it is today. I had no idea, this was a doctor. He was prescribing me medications, and I wound up going to a pain management doctor, and the amount of medication that I was getting prescribed, looking back on it, even now, is just insane. and I quickly became not just dependent on the drug, but addicted. You know, and you know, I struggled with that for a long time. I tried getting clean on my own. That didn't work. You know, and it eventually like progressed into something worse. I tried rehab a few times. I have been incarcerated a few times, and it's funny, like people look at me and they're like, you were in jail. Yeah, and that's, you know, that's my story. You know, and it led to like using heroin and, you know, other things. You know, I can remember, like I said, I've been to a few rehabs. Like I didn't get clean the first time. You know, I tried to get clean. You know, it took me a few tries. You know, I hit this like desperation. I can remember like I look back on it now and remember like the last few months before I got clean this time, because they say this disease progresses. Like each time, you know, I went back out there, it got worse. And I can remember, you know, just the desperation, like I had no will to live. You know, like I said, I was using heroin, but it was also like drinking, you know, among other things. And I had no will to live. And I was the type of person that, you know, I tried to get clean on my own. It didn't work, so I needed consequences in my life. You know, and my mother, who's always been my rock, you know, she had enough. She stopped enabling me a long time ago. You know, and I went to jail for the second time. And at that point I truly surrendered. You know, I wasn't angry when I went to jail this time, you know, and I jumped in, like, as soon as I got home, I got involved in a 12-step fellowship. You know, I started going to an outpatient program, and I met, you know, I say like one of my angels. She was my certified recovery specialist when I was in treatment at this outpatient program, and she like guided me in ways like I didn't know how to live clean, you know, because for 10 or more years in my life, you know, all I knew how to do was like use drugs and like manipulate and lie and steal. So when I got clean and actually like started working this program of recovery, you know, I tried to rebuild my life. Like I needed someone to like help me do that.
Right.
So she's a big part of my journey, and she's the one that encouraged me to go into this field. I had never thought in my entire life like that this is something that I wanted to do. And you know, it's the best decision I ever made. You know, like I mentioned, I'm in a 12-step recovery program, and they say, you know, you can only keep what you have by giving it away. And that's true. Like I can stay clean today because I'm able to help others. Like that's
right.
where my passion's at. You know, helping other people that are struggling like with this disease. Because like Erica said, you know, that stigma attached to it is just, you know, I you know, was scared to ask for help. I was ashamed. I was ashamed of the things that I've done, you know, and you know, I needed someone to like show me that there was a better way, and I want to be that for someone else too. So
That is so important, and a couple of the things that you touched upon really hit home, specifically that, you know, this can truly happen to anyone. When you look back at your life and the way that you grew up and the support that you had, it's not the typical stereotypical person that you would think, and it can truly happen to anyone. That's especially exactly how my sister started using, was because of a prescription drug that she was given by a doctor that she thought would help her, and obviously this was given by a doctor, and you think this is going to make me better and my problems are going to go away. And just so often that's not the case, and it does just bring just horrific things, not only to you, but to family and friends and so many other people that, you know, love you and know who you really are and who you were really meant to be. And so I think it's vital to hear from a certified recovery specialist, because I could tell someone, hey, you need to do this or that, but I've never used before in my life. But to hear it from you who's been through it, I think gives people the permission to be open, that they don't have to feel ashamed because they know that you know. They know that you understand and that you've been there. So it's almost like that amazing just window has just been opened for people, and it's just such a gift for other people. And so I think it's vitally important what you do. Can you talk about the different services that you offer? What's, you know, a typical day like?
So I'm part of Highlands Hospital, but we have what's called a Center of Excellence. So Governor Wolf gave this grant to 45 different agencies in Pennsylvania to help with this opioid crisis. And we're a physical health model. We're part of a hospital, so we're like a hub and spoke type model. So what we do is we get, people that come to us for help, whether it's like through our emergency room, we go in when somebody overdoses, and like Mary had said, it's easier when I walk in after somebody had overdosed, because I've been there before. I've been in a hospital bed, suffering from the disease of addiction. So when I walk up to someone and say, hey, I have this lived experience, it's kind of easier for them to open up and kind of, they know that I can relate to them. We work a lot like on behavioral health. But we refer a lot to other agencies in the county. We refer to drug and alcohol a lot. We have many different agencies in Fayette County. We have a great county. We truly do. We have a lot of great like drug and alcohol programs, Connellsville counseling. We have some great agencies. So we do a lot of referring out. We help people get into treatment. One of the, most important things that I do, we do refer people to treatment, but we like to follow them when they get out of treatment, because it's important for them, because 28 days and you're not cured. That's only the beginning. You go to treatment, you come home, and recovery is a lifelong process. So to have someone to guide them when they come home, that's beneficial to them. We can, I can take people to their first, meetings, whether it's like AA, Narcotics Anonymous, Celebrate Recovery. There's different 12-step fellowships, that they can get involved in, and help them just kind of get their life back together. We have, a bunch of different resources in this county that they know nothing about. So myself, as well as our case managers that we have working with us, can help navigate that for them, when they come home. Because, like I had said, in my experience, I had no idea
Right.
how to live my life,
Right.
when I got clean. And they have to kind of like relearn all that stuff.
Yeah, so I want to move to you, Roxanne. So you got involved as a community supporter. I kind of just wanted you to share with everyone how you got involved, why you got involved.
Well, probably we get 3 to 4 calls a day asking for drug and alcohol treatment. And what a lot of consumers and people in the community don't understand is we are licensed as a mental health clinic, but we are not licensed as a drug and alcohol clinic. So that's where we come in to, when we get those calls, to refer to these 2 agencies.
Right.
So what can we do for the person with an addiction is we can, if they're going through depression, if they're bipolar, we can treat that, but we can't treat the whole person.
Right.
It's just the way it's set up, and you're smiling, and
It's a complicated system.
yeah, it is.
That's
It's
why you need someone to help you navigate it. It's complicated.
They're both, diagnoses of mental health disorders, but they're definitely separate and apart. And I thought, what can we do? Because for the past 5 or 6 years, it's been my focus to give back to the community. Because the community's been very supportive of Connellsville counseling. We helped and did fundraising for the Circles program, for community ministries. So when I saw that the diocese was taking a role in this, I thought, now what can we do? And the hardest people, I think, for me to work with are people that have lost children, and children that have lost parents. So that's when I contacted you to offer a community support group.
Yeah, and it was such a blessing, because we had been kind of asking ourselves in our churches, what could we do? And we quickly realized, okay, well, obviously this isn't a recovery center, but we need to know who we can refer to them to. That's the first thing. And often we're just ignorant toward that, unfortunately. So we need to make it our business to know who we can refer them to. But more importantly, we need to, because most of the people we work with aren't the addicts themselves. It's the family and friends of addicts that are sitting in our pews and that are come to share with us. And we just saw them hurting in a lot of different ways. And we just kept saying, please give us a way that we can be there for these families. And that's when Roxanne said we could offer you a grief support group specifically for those loved ones who have lost someone to an addiction. And I think it's so important because it's a different kind of loss than just going to a regular grief support group. Do you agree with that, Roxanne?
From feedback from the groups we had through fall and winter is, I think they're looked down. They feel like they're looked down upon, that they don't feel like they are welcomed even at other groups, and that it is put back to a choice, and addiction is never a choice.
Right. And it's certainly not a choice for the families to lose a loved one to this disease. And it just brings up all of those old wounds, and it just makes you feel more isolated and alone and stigmatized, and you don't know who to turn, you don't know who to trust when you're going through such a thing. So to have that support is so important. Can you talk about what the format and content are going to be for the grief support group, and what you're going to start offering in the fall?
In the fall, I think we'll start in October. It'll always be the first Tuesday of the month. And I think what the format we're going to take is going to be a little bit different. It's going to be more of an education group in mindfulness. So if you're feeling stressed, you can't fall asleep at night, you always feel that you're on edge, and this is normal grief. This is what it feels like. Then we're going to be giving coping skills, lessons in coping skills on different subjects, and maybe how to practice meditation, things that help people relax, how to have more open communication with your family members. Some people don't want to talk about it, and everyone in the whole family's hurting, and nobody will talk about it. It's kind of like the elephant in the living room.
What's really amazing about this is, even though it's at St. John's in Connellsville at the social hall, this is not just for those Catholics. Is that correct?
We don't ask anything about your religious affiliation. And the other part is that I think it's really important is I bring two child therapists with me. So we don't want to call it babysitting, because it's really not. They work with the kids while the meeting's going on.
Yeah, that's really, really wonderful. The other thing that we started offering in our community as a result of Bishop Malesic coming and talking about initiatives is our Nar-Anon, which is a 12-step process for those family and friends who may have an addict in their life. And the family and friends need as much as a recovery support as those addicts themselves. Stephanie, can you talk a little bit about why it's so important for the family and friends of an addict to get support that they need?
It's always said, like, addiction is a family disease because it's the entire family that's affected. I know in my experience, like my mother, I put her through so much, when I was using, and for a while she did the enabling. She had no idea. Like, she would give me money. She just didn't want to see me sick. Like, she didn't want to see me suffer. But in the long run, like, that hurt me more than it helped me. And it wasn't until that I went to treatment and she got involved herself, and she got a little bit educated on the disease of addiction, and she stopped enabling, and I had to face consequences. But that's what I needed in my life, and if she would have kept enabling me, like, who knows where I could have been today. So I think it's important, when family members have somebody that struggles with addiction, that they get support, because it's scary. Like, you're watching somebody you love, go down this path, and, you feel helpless. And I've been to Nar-Anon groups. I've spoke there, and they're great. Like, my mom,
I think that's so important to hear from a certified recovery specialist at Nar-Anon, because a lot of times the family members are first of all, they're in denial that it's as bad as it is, or they just don't know what to do, or they think they can make them just go to rehab and everything's going to be okay. It's going to be this magic thing for them. And it's very helpful to have someone like you to say, this is the mind of what an addict is thinking about. This is where their mind is right now. And it's not about you, unfortunately. It's about that drug. And as much as they love you, unless they themselves want to get help, there's no amount of forcing that's going to make them get clean. And I think that's very helpful, because a lot of times as a family member, you just feel this immense guilt that there's something more you could be or should be doing, and you put that on yourself so much that it becomes overwhelming. And so we really want people to know that they're not alone, and we can give them the tools and the resources to know what they could be doing, what they are in control of and what they're not in control of when it comes to the addict in their life. So those are on Wednesday evenings, every single Wednesday at St. John's in the social hall from 7 to 8:30. And again, the grief support is every first Tuesday of the month, and we're going to be starting that October 2nd. But to kick all of that off, we're also going to be doing a recovery event coming up here in a few weeks. It's going to be Tuesday, September 18th, and it's also going to be at St. John's in Connellsville in the social hall. And we're going to have lots of different resources there. Can you guys just talk a little bit about what that night's going to be, who's going to be there, and what we're going to do that evening? So I'm going to start with you, Roxanne.
Well, I'm going to join you, Mary.
Yes, thanks.
I'm going to be there to talk about with families about how the group might be helpful for them or for children that they're raising, because that's what also we're seeing a lot of is grandparents raising children. So I'm going to be there to help support you and talk about our group and give some flyers out and
Perfect.
answer any questions they have about how they might be feeling right now.
That's really, really good. All right, wonderful. Stephanie?
I'm also going to be there. We're going to have a table set up with Highlands, so people can come and get information on all of the services that we offer, and how we can help them, as long as like different providers throughout the community and like other communities. Because there's treatment facilities in out of county, that we're going to invite so that family members and those struggling with addiction can have all these resources in one place.
Yeah, that's really good.
So, and Recovery Month, it's like my favorite.
Yeah.
Because like I said, this is my passion. So, to be involved in an event in our community and Connellsville, Fayette County, which I love so much, it's just exciting.
Yeah, absolutely. I get so angry when people, just say negative things constantly about Fayette County and Uniontown and Connellsville and the surrounding areas. And, we need to have that passion that you have and be the change that we want to see in our community, because if we don't, it's just we have just more to complain about. But there are so many good things going on, and there are so many good people that do want to make it better and are working really, really hard on that. Erica, I'm going to end with you about what you're going to have that evening available for people.
We'll have information about our office as well. I think what the biggest thing that I'd like to add is that Recovery Month is a celebration of recovery, and that's why it pulls on my heartstrings as well, because we so often hear such terrible things, all of the negative aspects of this disease, and people don't get to see that recovery is possible and that it's beautiful for the people that have it, and we want to show you here's how that can happen. Here's all these resources available to you and to your family, and that keep that hope that it can get better, and that just take advantage of all of these things. So I'm really excited to see all of that, and hopefully the more that we talk about it and people feel more comfortable and we'll seek treatment and get information, and we can address this at a community level.
Yeah, so this is going to be an amazing positive community event that we're going to have on Tuesday, September 18th from 6 to 8 at St. John the Evangelist Social Hall, which is downstairs from the church. The church is located right across from Sheets in Connellsville. So please come out, support the community, support all of the great resources that we have, and support each other. Support those that you know in your neighborhood, your family and friends that are going through this right now, and support those that you may know who are in recovery, and celebrate with them and tell them how proud you are of them every single day, that they are living their life the way that they were intended to live. So I just want to thank you for everything you guys do and for being a blessing in my life, certainly. And just thank you for being open to talking with us today about this and celebrating Recovery Month. We'll be right back.
Zoom from Armstrong, the area's fastest and most reliable internet, just keeps getting better. We're increasing Zoom 2 speeds to 300 megabits per second. That means more streaming and more downloads for more devices. And with those devices, you're going to need more data. Zoom customers, your monthly data allowance has increased to 1 terabyte and 2 terabytes for Zoom 2 and above. That's double the data. Visit ArmstrongOneWire.com/internet for more details. The future is faster with Zoom.
Thank you so much for joining us tonight, especially being able to talk about Recovery Month and just to celebrate with people the positive things. So often when I'm talking about the story of my family and my sister, you can think of it as a negative thing, but it truly has brought just so much passion in my life and purpose that I could take something horrific that has happened and to hopefully help other people to know that they're not alone, that we want to be there for them and to walk with them through this journey. So thank you so much for joining us, and we'll see you next time.